The Eastern Cape Health Department did not follow proper processes in its procurement of medical scooters. The public protector found that the 10 million rand contract was improper and in contravention of the legal prescripts. Acting Public Protector Kholeka Gcaleka says authorities in the province should take disciplinary action against those responsible. Well, joining us now to react to this is Jane Cowley. She is the DA Eastern Cape Shadow MEC for Health. Ms. Cowley, thank you very much for your time. In your view, how should this maladministration be remedied?
Thank you very much, Xoli, for this opportunity, and good morning to the viewers. We were vindicated, firstly, in this report. I think the Public Protector has encapsulated everything that went awry during this process, and many regulations had been flouted. So we are very pleased to see that remedial action needs to be taken, and she will be insisting on this. We believe the remedial action should be very, very strong, because this department is in a dire financial situation and cannot afford 1 cent of money spent incorrectly and cannot afford any further maladministration. You might have heard that this Department of Health in the Eastern Cape has contingent liability in excess of 36 billion rand and accruals in excess of 3.5 billion rand. That is service providers that have not been paid for services already delivered.
Yeah.
So, this is just, it once again reiterate, it sort of strengthens the view that there has been maladministration for many, many years, and firm action needs to be taken. So we sincerely hope that the current head of department does the right thing and, takes strong action against all of the people involved in this maladministration.
You talk about contingent liabilities that go into billions of rand. We're going to talk about that in just a second. But the Public Protector, one element I want to pick up on, Public Protector recommending that senior managers in the supply chain management division should attend a workshop on relevant legislation which regulates the procurement of goods and services, and this should be done within 60 days. What does that tell us about the competence levels of senior managers in this department?
I think you've hit the nail on the head there. If you don't employ people who are competent, and if you are paying senior managers massive salaries, and they do not know supply chain regulations, and they flout supply chain regulations, they flout triple BEE regulations, they flout the Constitution, then you have to ask yourself, do we have the right people in the right positions? I was very upset to see 2 or 3 prominent names, senior administrators within the health department who sat on the bid adjudication committee and the bid evaluation committee. And there is no excuse. There's absolutely no excuse for them to have allowed this process to get as far as it did. Because at that level, you expect somebody that is completely au fait with all the laws and regulations within which they need to work.
Yeah. Do you know, Jane, what has happened to these scooters now? What has the department done thus far?
Well, I think the process was stopped before any finances or any financial transaction took place. So it has been placed on hold. The whole transaction was placed on hold. I suspect strongly now that it's definitely not going to go ahead. There's been so much flouting of processes all the way back from January last year, in fact, even before that. So the money was never paid to the company, and the scooters were never taken, the scooters were never taken over by the Department of Health.
Yeah.
So at this stage, my advice to the Department of Health is clean house. You have infrastructure that needs maintenance. You have dozens, if not hundreds, of ambulances that are not on the road currently, that should be on the road, but are in for repairs. Once again, the systems are so slow. You know, we need to fix what we have in this department in order for it to become more effective. And honestly, looking at the financial status of the department, I cannot see them shopping for anything other than medication for years, if not decades to come. They have so many posts that are unfilled, and they are critical vacant posts for specialists, for doctors, for nurses. Those are the things they need to be taken care of. They can't afford to be looking outside and, you know, adopting new ways of doing things when they're not working with what they have.
Yeah. Two quick questions, Ms. Cowley, before we end our conversation. You mentioned that the Department of Health in the Eastern Cape has the contingent liability in excess of 35 billion rand. By the way, this is the highest contingent liability in the whole country. Add to that what the Auditor General said yesterday, that the province of the Eastern Cape, in its entirety, it has the highest unauthorized spending in the country. That's in excess of 1.59 billion. Firstly, why has this situation been allowed to continue like this?
Very good question, Kholi. You know, as the official opposition party in this province, it is our responsibility to hold government to account. And they will not account for this. For years and years, we've pressured them to clean house, to look at their finances, to make sure that irregular expenditure is a thing of the past. Unauthorized expenditure is a thing of the past. But unfortunately, it seems to fall on deaf ears because no consequences. There are no consequences for people who flout the regulations. Until there are consequences for such mismanagement and maladministration in all departments, until there are consequences for such behavior, nothing's going to change.
Final question. Do you think Premier Oscar Mabuyane is the man to turn things around? Does he have the capabilities?
Well, he insists that he wants to preside over a clean government. This is his perfect opportunity to clean house, because the head of department at the time of what they call the scooter scandal is now an advisor to the Premier in his office. So let's see if he can put his money where his mouth is and really clean house and hold people who conduct maladministration and mismanagement to account.
Jane Cowley, thank you very much for your time. The DA's Shadow Health MEC in the Eastern Cape province.